Hi, my name is Desiree Frantz. My colleagues Laurel Laviolette and Mary Duguna couldn't be with me today. We utilize the assistance of mentors Dr. Ga'a and Dr. Doon. Our research topic that I'll be discussing with you today is the impact of alcohol use and depression on physical performance among middle-aged and older adults. As you know, our global population is aging. Physical performance is associated with independence and quality of life among middle-aged and older adults. Physical performance also predicts future functioning, health, and healthcare utilization. However, modifiable factors that affect physical performance in this population remain unclear in research. The purpose of this study was to examine the independent associations of alcohol use and depression on one domain of physical performance. We decided grip strength. It was done in a representative sample of middle-aged and older adults. This study will provide important implications to develop tailored interventions that promote physical performance in this growing population. This is a secondary analysis of existing data. We use the baseline data from the China Health and Retirement Longitudinal Study, or CHARLS, and constructed a multivariate linear regression using SAS 9.4 to examine the independent association between alcohol use, depression, and physical performance. We controlled for socioeconomic factors and domestic partner status. The baseline data came from CHARLS and was collected between May 2011 and March 2012. It consisted of over 17,000 individuals from over 10,000 Chinese households who were at least 45 years old. The baseline survey was conducted via face-to-face computer-assisted household interview. Excluded participants were those who had a memory-related disease, severe hand pain, or had a hand or wrist surgery within the past 6 months. A dynamometer is a hand grip tool that measures grip strength, and after participants had been demonstrated in front of, they were asked to stand with their shoulders in neutral position, their elbows flexed at a 90-degree angle. They would grip the dynamometer in one hand and squeeze twice. They would then switch hands and perform the same exercise in the opposite hand. This was done for a total of 4 times, twice in each hand. The average of the 4 measurements were used for our data. Depression was measured using the Center for Epidemiological Studies depression scale. Alcohol use was self-reported. Never drinkers were those that had never drank in their lifetime. Former drinkers were those who had drank at one point but stopped. Moderate drinkers are those who drink up to 14 standard alcoholic drinks a week, and at-risk drinkers are those who have over 14 standard alcoholic drinks a week, one standard alcoholic drink being 14 grams of pure alcohol. Our study population consisted of 12,488 Chinese adults with an average age of 59 years old. 46% were male, 88% were married. The prevalence of ever drinking during lifetime and current at-risk drinking in this population was 26% and 15% respectively. 28% of the study population had depression. Based on our multilinear regression results, compared with never drinkers, moderate and at-risk alcohol use was independently associated with better grip strength. Depression was independently negatively associated with grip strength. This suggests that alcohol use might be protective of physical performance, whereas depression might be detrimental to physical performance among middle-aged and older adults. However, the underlying mechanism is still unclear. Given the negative impact of alcohol on other body systems, clinicians should assess alcohol use and depression in middle-aged and older patients using validated tools and provide resources and strategies to effectively manage alcohol use or depression. Furthermore, clinicians should counsel patients that if depression is not managed, patients may suffer from depression-associated health consequences, such as declined physical performance. This does conclude my research topic discussion. Thank you so much. And are there any questions?